See if you can see your monkey ranch.
Monkey brain. Monkey Ranch. Here we go. Yep.
Yeah?
Got a Monkey Ranch.
And you got your audio up too, because I just heard.
Yep. I got my echo. There's old Sean.
Shawnee Pete! All right. Mic's up. You guys okay?
Yeah,
Hello?
I didn't
Okay,
mute
good.
mine.
Oops. Sorry.
Oh, for fuck's sakes. The alarm at my house.
I'm a
is going.
damn idiot.
Hang on.
Huh?
The alarm at my house is
Oh, alarm going off? Okay, well,
Yeah, for
perfect
fuck's
timing for
sakes.
me to fuck this show up.
Sorry.
Do you need out of here?
I'll turn it up. Okay, Dr. Scott's got an emergency. We'll be right back. Try that again. It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. The longest running show on this channel. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical provider who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And also we have with us Tacey, my partner in all things. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio. If you got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347
Poohhead.
Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy that I can't mention because I have a contract with SiriusXM. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. Hello, Dr. Scott. Don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And probably help the noise in the background if I turn off the air conditioning.
I thought we had it. Tasted over.
I wondered why. It was like, why is this opening so spotty? And I realized I forgot to turn the stupid thing off. So anyway, yeah, Tacey will get hot and she'll be taking her clothes off in around 33 minutes because it's 1,000 degrees up here. Thank you, Tace. Want to say happy birthday to the founder of our network, Cardiff Electric. Thank you, sir, and happy birthday. So now we've got some things to, by God, talk about today.
Oh, yeah.
So you want to talk about the new CDC recommendations for quarantine and isolation?
I would love to.
Did you have something that you would rather talk about instead?
No, I've got a couple other good ones, but I think let's do that first because that's the most current and important thing to talk about first.
Yeah. So, yeah. Oh, follow the science. You know how many people got deplatformed and got in trouble for saying that natural immunity and is probably as good as being vaccinated, et cetera, and now basically that's what they're saying. It says regardless. Let me find it, Dr. Scott. Here I went to the wrong web page. Let's see here. Damn it!
I was just in the process of looking that up to you.
Oh, you were?
Just,
okay. Yeah.
No,
Well, look it
not
up.
Really.
Okay. No,
No, I found another good one.
Okay, well, that's hell. I started this. Okay, here we go. COVID-19 quarantine and isolation. Very good. Carl would say, we could have just gone back and edited this out, but we're doing it live for SiriusXM and other places, so it's hard to do. But anyway, fuck it. You know what? I am going to fix that. Hang on. Let's just go back.
Are we doing this live, really?
Yeah.
For SiriusXM?
So let's talk about the new CDC guidelines for isolation and quarantine for COVID-19.
All right.
So, it's very interesting, some of the perspectives on here that really, if you had said some of the shit that they say on this CDC site 6 months ago, you would have been deplatformed from some places.
Yeah. Like we were kind of.
Well, that's right.
Without
That's
doing
right.
anything wrong. Yep.
We absolutely did nothing wrong. We mentioned two words in the same sentence, and it got us, it got us a content warning that said that if we did it again, they were going to deplatform us altogether.
Unbelievable.
We finally won that one, but it was ridiculous. So let's see here. What it says is, regardless of vaccination status, you should isolate from others when you have COVID-19, of course. You should also isolate if you're sick and suspect that you have COVID-19 but do not yet have test results, of course. You should do that anytime. If you have a puke bug, you should do that. If your results are positive, follow the full isolation recommendations below. If they're negative, you end your isolation. So if you test negative, go do what the hell you want to do. If you test positive, then you're to follow the full isolation recommendations below. And it says if you had COVID-19, and it's counted in days as follows. If you had no symptoms, day 0 is the day you were tested, not the day you received your positive test result. So if it took 3 days, let's say, you got kind of sick on Monday, you say, I'm going to go get tested. And that was on Monday, you get your results back on Wednesday, and it's positive, but you have no symptoms. You start counting from Monday, not Wednesday, okay?
Okay.
Day 1 is the first full day following the day you were tested. And if you develop symptoms within the 10 days, the clock restarts at day 0 on the day of symptom onset. So if you had no symptoms, but all of a sudden you develop symptoms on Thursday and you tested on Monday, day 0 is now Thursday, and day 1 would be Friday. Now, if you had symptoms, day 0 is the day that you had symptoms, regardless of when you tested positive. So let's say you're an asshole and you had symptoms on Friday, and then you went and partied and stuff, and and then tested on Monday, and you got your results on Wednesday, and you were positive. Day 1 is it would be on Saturday if your symptoms started on Friday. Okay, so day 0 would be Friday. Now, if you test positive, stay home for 5 days. Isolate from others in your home, because that's the time when you're most infectious. Wear a high-quality mask if you must be around others at home and in public. Do not go places where you're unable to wear a mask. Do not travel. I mean, really, seriously, don't get in a plane. Stay home, separate from others as much as possible. Use a separate bathroom if possible. Don't share personal household items like cups. Well, I can't drink out of that cup you just had that's got the COVID in it. No shit.
No.
I wish I had Carl's no shit, Sherlock, no shit drop. I may have to ask him for that. And, we could do this one.
Well, that's because you're an idiot.
Anyway, all right. Now, when do you end isolation? If you had no symptoms the whole time, you end isolation after day 5. And if you had symptoms, you can end isolation after day 5 if you're fever-free for 24 hours without the use of Tylenol, ibuprofen, or naproxen, and your symptoms are improving. They don't have to be gone. They just have to be improving.
Gotcha.
If you still have fever, continue to isolate till they improve. Now, this is mild illness. This is just self-limited. If you had moderate illness, that's shortness of breath or difficulty breathing, or severe illness, in other words, you were hospitalized. That's the definition now. Or you have a weakened immune system. Isolate through day 10. All right? And it really, if you had severe illness, you need to consult your doctor before you come out of isolation, although they're going to go, I don't know. It's right here. Regardless of when you end isolation, avoid being around people who are more likely to get very sick from COVID-19 until at least day 11. Wear a high-quality mask when indoors around others, and not to go places when you're unable to wear a mask till you're unable to until you're able to discontinue masking. See below. So now they got another section for removing your mask.
Uh-oh.
After you've ended isolation, that means you've done whatever the things we just talked about. You still got to wear a mask through day 10, with day 0 being whatever we just said it was.
Okay.
Or if you have access to antigen tests, you should consider using them. This is new. They said before, don't keep testing yourself.
Okay.
Because people will continue to test positive. Some people will. Mm-hmm. They'll continue to secrete viral RNA through their noses for some time. And that doesn't mean they're infectious, but they'll test positive because the test doesn't test for whether you can transmit the disease to somebody. It just, let's get Tacey on camera there. That gets that yawn. She's having a wonderful time. It doesn't test whether you can give it to somebody. It just tests whether you have viral RNA in your nose, and the two things are not the same. But it says you should consider using them with 2 sequential negative tests 48 hours apart. You may remove your mask sooner than day 10. So in the past, they always said just wear it if you get out in 5 days, you got to wear it for another 5 days. Now they're saying if you do antigen tests and 2 of them are negative, you can remove it sooner. It doesn't say if that's positive, you can't. You still remove it on day 10. You can just do it sooner than that if you test negative with those tests.
Gotcha.
So I think that's reasonable.
Yeah.
All right. And there you go. Doesn't say anything about whether you've had a vaccine or not on none of this. Or if you had immunity before this, or, if you have had COVID-19 before, because they figured out if you get the vaccine, you're still probably you have a good chance of getting COVID in an area where there's a lot of high transmission, and it's a new variant that you didn't have before. So, for example, I had Delta, this new Omicron variant, the new BA, what the fuck. Mm-hmm. I may end up getting it.
Yep.
I'm hoping that my previous vaccine, 2 boosters, and COVID-19 will help carry me through that so that I don't have what happened last time, which was massive scarring in my lungs.
Yes.
So, Tacey, knock on wood, so far to her knowledge, has not had it. I would love to do antibody test on you. It would be a fun thing that maybe we could do for the show, because you were exposed to me when I had that badass variant, but you had been fully vaccinated. Liam sat right next to me with me hawking him because I had to help him with his homework the first night, if you remember. We weren't really sure what was going on. And he didn't get it, as far as we know. If he did, he had an asymptomatic. So it'd be kind of fun to do COVID-19 antibodies on you, just see what you've got.
Where do you even go to get those?
Oh, I just write an order for COVID-19 antibodies. You just go to my office and get your blood drawn. But I think that would be a very educational thing to know. And they do so. I think that, can you look up the head of Pfizer and Google how many times he's had COVID-19? Because I've heard this. I don't want to say it if it's not true. Pfizer CEO, COVID let's just say COVID infection, and see if anything comes up. Because I think, So here's from NBC News. Pfizer CEO Albert Bourla tests positive for COVID, says he's experiencing very mild symptoms. He had the vaccine. He's been double boosted, I think. And he also started Paxlovid because, he's 60, so he's in that area. I don't know if he has any risk factors. I don't know his medical background. So he's on, and Paxlovid is their drug. So early on in this thing, we were told if you get the vaccine, you won't get COVID-19. We had prominent people in NIH, without naming any names, prominent people in the government, one of the the highest office in the government, telling us if you get the vaccine, you won't get COVID-19. No, it wasn't true. And if you, at that point, said something opposite than that, you could get deplatformed. So we all know that that's not true. You'll still get it. Now, am I against the vaccine? No, because I still think that the benefits outweigh the risk. And so I'm sort of in the middle. You got the people who are against the vaccine altogether, and then people who are just vaccine loyalists. And let's look at the truth. It does decrease the risk of going to the hospital, which is what I care about.
Yeah.
I don't care if you get it. Said that just since the beginning. We don't care about cases. What we care about, because we never tracked cases of the common cold before.
No.
And knowing that many of those were coronaviruses, and every year 10 to 20,000 people died from those.
Yep.
And we just called it atypical pneumonia or viral pneumonia. We didn't test for it. Now we're testing for it. We see it everywhere.
Yeah.
Yeah, go ahead.
Well, I was just going to say, well, now when people have this, a couple years ago before COVID, it would have been the summer cold. We saw it.
Yeah.
We've seen it every single year forever. It's common cold. It's not a big deal.
And many of those were coronaviruses.
Yes.
And there's adenoviruses, there's picornaviruses, there are all these asshole viruses out there that just infect us to no purpose other than to just reproduce. So I think that now that we're kind of getting used to the idea of this, that these viruses are there all the time, that we may be able to move forward to declaring war on human coronaviruses. Let's just destroy them all. And I have no compunction about that. They don't do anything positive that I'm aware of. Just get rid of them.
Yeah.
And then, you know what?
Until we can use them to hijack and treat cancers and stuff like that.
Well, I'm okay with that.
Yeah.
Okay. Then they're good. Measles vaccine is a live attenuated virus that can be used to kill multiple myeloma, at least in one study.
Isn't that crazy?
So I'm fine with that. They do some interesting things. They don't do it on their own, though. We have to make them do it. We have to re-engineer them to do the things we want them to do.
They're just little computers.
They're little nano machines that all they do is reproduce.
We just program them and they do their thing. Very male. They're very masculine little boogers.
Oh, really? Is that what it is? Okay.
Not real smart. They're just out for one thing, to reproduce.
Sounds like some people I know too.
Toxic masculinity, those viruses. Ugh. So anyway, yeah. Anyway, so you can get it, you can transmit it, but the vaccine, the data is very solid that it helps prevent severe disease, which is what we cared about. That's what they said in the beginning, that we're 2 weeks to flatten the curve was supposed to keep the medical system from becoming overwhelmed.
Right.
And it did become overwhelmed anyway, and now it's not overwhelmed. So look at the data. You can see the cases are not as high as they were during the first Omicron peak, and hospitalizations are still flat. So anyway, all right. Not to say people don't still get sick. And when we had, at the very tail end of this, when we still had ICUs full of people for a while there, the only people we had in the ICU were people who were unvaccinated. I will say that.
Yep.
Now, that is not scientifically sound. You have to look at the whole population. But it's a fact. You ask anyone who worked in the ICU that if they had someone in there that had been vaccinated, that was very unusual, and they usually had some other problem, like they were on chemotherapy or something like that.
They were pretty ill.
Yeah.
Yeah.
Anyway, okay. So there they go. The CDC is following the science. After all this time of telling us to follow the science, I don't know. It's. I understand they have to be very conservative, and they don't want to say anything wrong, but goodness gracious.
It is insane.
So this is more rational, though.
Yep. It makes sense.
To me.
Tasty, say something. They think you're a cardboard.
I am cardboard.
Who said she was cardboard?
No, they're just saying, have Tasty say something.
No, she agreed. This is one thing she probably agrees with me.
Yep.
All right. Yeah, Tacey, so how's it going?
It's going okay.
How's the old vag?
Oh, vag is good.
Okay. We did.
Well, it's getting late.
Oh, let's talk about
Golly.
the dream we had, Steve.
Oh, yes. Thank you. Well, the reason I asked about your nether regions is because we did a show about you having the radio frequency stimulation.
Yes.
And then we also had Gina Levy on our Patreon. And people will know her. She's on Twitter a lot, but it's okay. I don't like to define people by who they're married to, but she's Bob Levy's wife.
Never happens to me.
Yeah.
Never happens to me.
Tacy's Dr. Steve's wife. Who?
I know, it happens to me all the time.
Who? Anyway. So, but that was a fun Patreon show. We did Girl Talk with Tacy and Gina. We need to do that again.
Yeah.
You guys talked about
Or I thought
surgical mishaps, cosmetic surgical
Yeah,
mishaps.
just having if people who have interesting medical stories, I think that would be great
Yeah.
stuff for Patreon too.
Agreed. Yeah.
I mean, because there's lots of stories out there.
Oh yeah. But anyway, so we had this weird dream. So Scott, have you ever had this happen? And then we'll throw this is crazy, and then we'll throw the extra crazy on at the very end.
Cool.
So have you ever had a dream where you're taking a dump in your dream, and then you wake up going, God, I hope I didn't actually just shit the bed? So he's got to think about it. Anyway.
I don't think so.
Okay.
Yeah.
So,
Maybe with the bed, but I don't think about.
okay, we're
Thinking of-
pissing
yeah,
in your
okay.
dream and you're worried when
Yeah.
you wake up. Well, I had a dream. I had an inception dream where it was a dream within a dream where I dreamt that I passed gas in the shower and just shit all over everywhere.
Oh no.
And, just sort of like Marvin's head in Pulp Fiction, except it was shit. Instead of blood coming out of his head, it was shit coming out of my ass. And it splattered against the back wall of the shower. And I was like, what in the hell? And then in my dream, I wake up, but I'm still sleeping. I'm dreaming this. I'm dreaming that I woke up and I went, oh my God, I hope I didn't shit the bed. And then I woke up for real and went, oh my God, thank God that was a dream. So I called Tacy in the morning, on my way when I was driving back from work. I said, we had the weirdest dream last night. And I told her that. And then what did you say?
I had the same dream. It's scary
That
when
is
you
something
think
weird.
you're going to the bathroom
But why
in your dream.
Why did we
What-
dream that on the same night?
What keeps you from actually doing it?
I don't
No,
know.
one of these
And
days.
how embarrassing is that going to be when it does happen? Because one
then
of
what
these
happened?
days-
Yes, one of these days. And then what happens if then now you just
We'll put him in the institution.
Well, what
if
if
you
it's
old folks
me?
home.
I mean, what do you say? I'm sorry I was dreaming it. I can't
Yeah.
help it.
yeah.
I mean, but that is disgusting.
That was tough. That's a tough
Yeah,
way to go.
I was dreaming that I was having sex with that stripper taste.
Yep. Mhm.
When what I'm concerned about is that maybe it would happen once and it'd be like a weird thing, but what if you start doing it? It's when you start doing something, it's like it's okay to do it. It's like when you smoke that one cigarette, you smoke a pack a day. What if you just start shitting the bed every night? That would be horrible.
Yeah, we would get, what do they call it when you separate beds?
You separate rooms.
Well, I mean, it's called like a divorce, a bedroom divorce or something.
Oh, it'd be like
There's
a
actually a term for
Lucy and Desi bed or something.
it. No, it's
remember
different rooms.
Desi and Lucy, were married and they had a kid, but they always would have to show them in separate beds because, God forbid, back
yeah.
then that they implied that a man and a woman would sleep in the same bed. How
Unbelievable.
prudish were we back then?
That's crazy.
We're not that much less prudish now. If you watch Love Island UK, they're calling people everything you can think of, including the C word, that I can't even really say on Sirius XM. I mean, I could. Or on our podcast.
It's just not nice.
No, it's not,
But
it's
they,
not proper.
of course, it means something different. But then they, so I've always been told that the C word is like, oh, that's like, wanker or something like that. It's not, that big of a deal to say. But then I was heard that fanny in the UK means, is a pejorative for vagina. But then they say that too. That Maura on season 5, oh, I got the fanny flutters.
Oh my God.
but they say shit and fuck and dick and
Everything.
bell end and all kinds of stuff on there. And we can't get any of that on our TV.
No.
Cable every once in a while they said the S word, and it's like I don't understand why we're so different in that way.
Scott, you really should join us on the Love Island UK.
Oh my God, it's the greatest show of all time.
Yeah, I can
It's
tell I'm
only
missing it.
52 episodes a season.
So I was talking to Greg Hughes, the actor that played Opie on the Opie and Anthony show, and today, and he was talking about how his wife and kid watch trash TV, and I said, "Oh, I got one for you, but don't let the 9-year-old watch it."
Yeah.
And so they'll report back. We'll see.
Oh, funny. Yeah, I'll have to
I may have
binge
just
watch it. This
ruined
winter.
them too. No, there's 8 seasons, and there's 50 episodes a season.
Oh my God.
Because they in the UK they do Monday through Thursday, and then Friday they have this thing called
After Sun.
After Sun, where they do a recap, and then they'll do unseen bits where they have like outtakes and stuff.
Jeez.
But it's every night.
Oh my God.
Yeah, so we only watch the
We don't watch After Sun. We don't have that kind of time.
No.
no.
So we only watch 3. Actually, we're watching 2 seasons, so that's
Right,
not true.
we're watching season 8 and season 5.
Oh my God, it's hilarious. That's hilarious. Lord.
Well, we like Davide and Ekin-Su, so
That is funny.
you are a liar. All right. So, okay, where are we?
We were going to
We've
take
gone
some
off the
calls.
rails, sorry.
I think Scott's got a story.
Okay.
Yeah, I've got one if you want a story. You want to go to whatever.
Let's do some calls. You got anything pressing story-wise?
It can wait till next week.
Are you sure?
Yeah, it's a good.
It's a good one?
It's a
That
good
way
one.
you don't have to look up anything next
Okay,
week,
yeah.
Scott.
Number one thing, don't take advice from some asshole on the radio.
Okay, so here is a disgruntled acupuncture
Uh-oh.
Uh-oh.
person.
Hey, what's up? I'm tired right now, but I just wondered about acupuncture. If they say 60 minutes, but it's 45 minutes, what's the deal? Thanks. I don't know if I'll even get a chance to listen. I don't have the on-demand, but yeah, they say it's 60 minutes, 45 minutes. Thanks for everything. Thanks for your help. Love the show. I just can't hear it all the time.
Yeah, man.
Used to be on more in 2014, I think, or years past. I don't know. They change up the times. Now the channel's gone crazy. You don't have to put all that in there. If you
No,
don't.
it's too late, dude. Sorry
Too
about that. I was trying to see if there was more to your question. Yeah, so Scott, what's the deal? It says 60-minute appointment, and it's only 45 minutes. What the fuck, dude?
You are a liar.
You are a liar. I've got to get that drop for my soundboard of Davide saying, "You are a liar."
I would suggest that hopefully, regardless of the time, he's getting appropriate care.
Yeah, so 60-minute appointments.
It would be an awfully long
Yeah.
time. I mean, I do 15 minutes. I don't want people expecting much out of me, if you know what I mean.
Yeah.
I like to keep the threshold
Well, I do think
low.
that the marketing side at this practice, wherever he
It's
is
poor.
they need to take that into account because people want to get their money's
Yeah,
worth.
exactly. Yeah.
And if you're going to do 45 minutes, say 45 minutes.
Yep.
Or do this, say 30 and give them 45.
Then they
know?
get extra. No, I agree with you.
Yeah, and then they feel like they're getting more than they bargained for. What really probably happens is they have 60-minute slots.
Mm-hmm.
And I'm assuming it was an initial visit, but I don't know.
One would think, yeah.
And they have 60-minute slots, and they probably said, we allot 60 minutes for this or whatever. But 15 minutes of it is checking you in, getting your insurance information, doing checking you out, getting you set up for the next thing.
Yep.
So they need to be more upfront about that, I think, or more clear.
Yeah,
about it.
I think this is solely just a
Communication
issue. Yeah, but I hopefully he's getting.
But it's
great
not on the
care.
patient side. This
No,
is
no,
absolutely
no.
on the
The
officer
provider, yeah,
side.
yeah.
You've got the provider side. You've got to be clear about the expectations because these kinds of things will happen.
And they will, and it's bad for your reputation.
It is.
Yep.
There's. Let's do some other stuff.
That guy's not going around talking about how great it was. He's
No.
just going around talking about how
Got
he
15
didn't get
minutes
his...
short.
And that's the
Yeah.
thing. He actually had a good experience there.
Yeah, that's what he said. It was a good experience, but he was expecting,
Yeah.
60 minutes and.
Because we've talked to him, on the side, and he said he had a great experience. He's just wondering why they said 60 and only gave him 45. I don't blame him.
Yeah.
Now, there are other things that physicians and any provider can do that are shitty, and we don't even realize it. That's one of them.
Yeah.
Managing expectations, etc. So overpromising, that kind of thing. So that's a given. Using the words, well, there's two words that we use that our patients use completely different than we do, and that's positive and negative. If you have a positive attitude, that's a good thing. If you have a positive checking account balance, that's a good thing. If you have a positive lung biopsy, that's not a good thing.
Mm-hmm.
And so, and using negative. If you have a negative balance, that's a bad thing, but a negative biopsy is a good thing. So I had a friend of mine who's a physician, and I was giving this talk to physicians about why we shouldn't use words like that, at least not the way we use them. And he said that his mom got a call, I think I've told this story before, from her doctor's office, and she said, "Oh, thank God, my influenza test was positive."
Mm-hmm.
And she's thinking that means it was a good thing.
Yes.
Now, who would call a patient and say, "Oh, your test was positive. Well, thank you," click.
Exactly. That's a terrible idea.
No, it's just terrible communication. Either that or she just didn't hear the rest, which happens too.
Sure. Yep.
If you just front load bad news to somebody and just dump the news in their lap without letting them know it's coming first, they won't hear anything else.
Now they shut down.
If you just go, "Well, you've got stage 4 cancer," that's ding, 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 ding. All you're going to hear is cancer, cancer, cancer in your head. Whereas if you say, this biopsy didn't turn out the way we hoped it would.
Mm-hmm. Yeah.
It looks like it. There's cancer there, and it looks like it's spread. That's chopping it up into little bits, warning them that the bad news is coming, and then pausing to get the reaction and doing back and forth, and then empathy and validation, all that stuff. None of that was done with my friend's mom. No. "Well, your test was positive. See you later." Have fun with that
Good
information.
luck. Call us if you need us.
Yeah.
Oh,
yeah, and she thought that meant that she didn't have influenza. So normal and abnormal.
Mm-hmm.
Ahmed, if you're listening, don't say positive and negative to your patients.
No.
Normal and abnormal.
Yep.
Okay.
All right. How he's doing? Hopefully
he's doing great. I've been in touch with him.
Oh, cool.
He's had some amazing experiences, and they had an experience recently that I actually was a case very similar to that I had written about in the National Medical Literature. Don't you know? Ooh, yeah. Thank you. I wish I had the drop. No one said there'd be boasting, and I'll have to get that one for next time too. And I sent him that article so he can sound highfalutin on rounds when they talk about it. So,
that's cool.
Yeah,
he's a good one.
He's going to try
He's
to
a
get
good
back
one.
down here again. So.
Good.
All right. If you don't know who we're talking about, go to our podcast and go back, and it's I think it's Ahmed Saves the World or something like that.
Real quick. Speaking of the communications things, DP was saying that he had
Darren Parker.
Yeah, he was talking about his nuclear stress test. They said it looks uninteresting.
Oh God. Oh, that's hilarious.
It's like
uninteresting.
Yes.
Yeah, it's like we're bored looking at this.
Yes, uninteresting. may want to follow.
And I would understand what they meant.
Right.
You don't want an interesting
Yeah.
test, but that just sounds like you don't give a shit.
Yeah.
And it's like I'll hear doctors say, "Well, we're going to withdraw care." We never stop saying that. We never withdraw care.
Mm-hmm.
We never stop caring for our patients.
Mm-hmm.
We can, stop providing certain treatments.
Mm-hmm. We're
Withdrawing care.
We're going to amend our protocol.
Yeah. Okay, that sounds
much
pretty
better.
snooty, but yeah, that'd be better than saying we're going to withdraw care.
Exactly.
Anyway, all right. Want to do another one?
Yeah.
Well, all right. Well, where the hell is it? Oh,
Frank.
Sorry, buddy.
Hello, Dr. Steve.
Hey, man.
Good morning.
Good morning.
Frank from Indiana here.
Hey, Frank.
I was wondering, I had a question, well, two questions actually. With my sore throats, it seems like we're getting a lot more sore throats around, I guess, due to COVID. What do you think about gargling with half hydrogen peroxide, half water. It seems like it burns that shit right out.
Yeah, it feels like it, doesn't it?
Didn't know if that was safe, harmful, or what. But. And then the second part of the question was about the soap clean machine.
Yes.
They heard a lot of negative stuff about those lately, and I didn't know if that ozone was particularly harmful or anything like that. Or
Okay.
burning up the equipment and all kinds of stuff. I was just wondering your thoughts on that.
Okay, well, I don't want to talk about any specific brands of anything, but when I was told I had pulmonary fibrosis, which turned out not to be true, I looked up to see if ozone, ozone. There are lots of different brands of ozone generators that you can use for cleaning your CPAP machines or BiPAP machines or other things. And I wanted to see, and there was a couple of articles in the national medical literature that said, yeah, there might be an association, but it's really flimsy. And that would be exposure to high doses of ozone. And when you have one of those machines, they have ways that they circulate regular air through there to clean out the ozone, et cetera. So whatever you're getting is not a very high dose, and it doesn't really hang around. I mean, ozone is, oxygen 3. Mm-hmm. So, or instead of O2, which is oxygen, is gaseous oxygen, ozone is O3. So it's because oxygen likes to live as O2, it's stable there. That extra oxygen molecule atom will peel off, and then it'll be very reactive until it combines with another free oxygen atom to make O2 again. But it can react with all kinds of stuff.
Okay.
And so that's the issue, is that you have ozone will kill bacteria and stuff like that. It'll sterilize things. It doesn't actually clean anything.
Mm-hmm.
So talk to your provider about it. Some of the providers sell them, and they think the pulmonologists and sleep people will sell those things, and some of them don't recommend them. So if you get on these forums, they'll say absolutely not. I'm fine with it as long as you run it, and I haven't seen any data that says that they're dangerous. I'm just not sure how much good that they do.
Okay.
I stopped using mine, and I just clean. I follow the instructions. I clean mine once a week with vinegar and water, warm water, and dry it and do all that stuff, and then change it when you're supposed to. I haven't had any problems. So
Yeah, so you're kind of on your own with that one.
yeah, Tacey still uses hers. So.
Well, I use it once a week now.
Yep.
And I clean my machine. I figure once a week's going to at least clean the reservoir.
Yeah.
So
Yeah, the reservoir is a little tough to clean, and so if you run it through there, at least it's sterilized, and that's where the water is. So I will keep looking at that if I ever see any really damning information. Of course, if there really was or were damning data on this, I would think the FDA would have yanked them already. So the data that I saw was really flimsy, and so it didn't really affect my decision. I just figured if it isn't helping, I'm not going to mess with it anymore. Now, what was the first part of his question? Oh, hydrogen peroxide. So
gargling it.
I'm not opposed to it. When I used to try to gargle with hydrogen peroxide, even diluting it 50-50, it would foam up in my mouth, and then you end up swallowing that stuff. It always make me feel kind of vaguely ill. It might help ease a sore throat, particularly if it's a bacterial infection, by maybe knocking back some of the bacteria. And just that tingling and burning makes you always think you're doing something.
Mm-hmm.
When I've had people with fungal infections of the nuts, we'll call it tinea cruris, fungal infection of the inguinal region, they'll put bleach on it and say, oh, yeah, I was burning it out with the bleach. It doesn't really work. You'd think it would, but it doesn't. It doesn't. Sorry. Damn it. Hang on just a sec. No, my allergy. It's allergy season.
Mm-hmm.
Hang on. Let me see what. But it just doesn't kill the hyphae, of the fungal forms of those organisms, and part of them are buried into the skin.
Right, they're deeper than just top.
So you have to
surface,
actually
yeah.
use an antifungal medication for that, and the bleach. But it feels like you're doing something because it burns so bad.
Yeah.
So anyway, there's a randomized trial from 2017 on hydrogen peroxide where they looked at 53 people that tested hydrogen peroxide as a treatment for gum disease. And one group received root debridement and hydrogen peroxide. And the other group just received root debridement. So debridement is just, scraping away of yucky crap.
Okay.
And that results indicated the hydrogen peroxide group had fewer signs of gum disease by the end of the study compared to the group that had received the root debridement alone. This is not a placebo-controlled trial. Be hard to do in a situation like this.
Yep.
So, so there you go. Just don't drink it and don't be ridiculous.
Mm-hmm.
Now, one thing I did
And
find.
dilute it.
And dilute it.
Yeah, for
yes,
sure.
Yes, absolutely. And talk to your oral care provider on that stuff. But one thing that I found was, I used to get aphthous ulcers. I call them canker sores. Mm-hmm. And canker sores are sort of well demarcated, scooped out ulcers in your mouth, and they hurt like hell, and they seem to go on longer than they should. Mm-hmm. So before I found canker covers, which is my favorite thing now, it's a gel bandage that you just stick on there, and it sometimes will heal them overnight.
Wow.
So look for canker covers. They're kind of a pain to put on.
They're disgusting to put on.
You've tried it, right?
Yes, and yeah.
No
Yeah,
fun.
you have to get it on the end of your finger, and you've got to open up your mouth, and you got to stick it right on there. You got to hold it on there for 30 seconds, so it will adhere to that to the ulcer preferentially over your finger.
Right.
Because it's kind of sticky, and it'll stick to your finger too. So you want it to stick harder to your mouth than it will to your finger. So you got to hold it there for a while, and that turns into this sort of hydrophilic gel.
Okay.
It makes a bandage.
Okay.
And it turns out that part of the reason canker sores won't heal is because you're just constantly washing saliva over them. And it takes away the fight.
And kind of nourishes them.
Sorry. Hang on. I don't know what's wrong with me today. It's starting. This is my fall. My fall bullshit is starting up again.
'Tis the season.
Oh. Yeah, it is. I'm just going to have to start being more proactive about taking my allergy medicine. God damn it. Is because you're constantly washing saliva over them and mushing your tongue over them and eating and stuff. And when you put this bandage on there, it allows that area to heal very rapidly because the inside of the mouth, generally, it's got really great blood supply. It should heal quickly. But the other thing I found that helped is if I took a Q-tip and I dipped it in hydrogen peroxide, the regular kind that you buy, whatever the 1 to 3%. What is it, 1% or the 3%? Scott, will you look it up? I don't want to tell somebody to get the wrong thing, but there's stuff in the brown bottle that you can just buy over the counter at CVS. And I would stick the Q-tip in there and then just hold it right onto the base of the canker sore for like 15, 30 seconds. That way you're not getting so much in your mouth that it's foaming up.
3%.
Thank you. It's foaming up and you're swallowing it and making yourself sick. And you get that horrible taste in your mouth and stuff. So I would just apply it only to where the canker sore was, so you didn't get all of that extra stuff in your mouth that's going to places that don't require it. And that would help too. I'd do that for a couple of days, and they would go away faster that way too. I do not have data on that. That is anecdotal data, but I found that to be effective as well. Now, if you have multiple canker sores. We might as well talk about canker sores for a minute.
Seems like you want to.
Well, I do want to.
All right,
because
then.
it's something I can wax eloquent about.
Okay.
If you get them frequently and get multiple ones, get your blood, your red blood cells checked. People who are anemic, even slightly anemic, may get aphthous ulcers. And also, you want to use a biotin-free toothpaste. And no, I'm sorry, that's wrong. No, you want to use biotin, the toothpaste biotin, because it is sodium lauryl sulfate free. I just said something stupid, so let me give me one of these.
Well, that's because you're an idiot.
So, you want to use a sodium lauryl sulfate-free toothpaste, and the one that I know its brand name is Biotin. Okay, all right, and that sometimes will help as well. But if you have tons of them and your just mouth is always in agony, then absolutely see your primary care provider. Make sure that you're not missing something. Now, one of the other things about peroxide, by the way, I guess we should talk about, is that is the active ingredient in most of these teeth whitening things.
Mm-hmm.
You know, they'll put it in gel, and then you put the gel into sort of a mold that's molded to your teeth, and then you apply it. And some of them will use ultraviolet light to activate the hydrogen peroxide. And really, what they're doing at that point, in hydrogen peroxide, we were talking about ozone. Here's another, free oxygen running around. Is water is H2O, 2 hydrogens and an oxygen, and hydrogen peroxide is H2O2. So it's got that extra oxygen that's easily kicked off of there, and it just wants to react with something.
Okay.
So, and apparently using ultraviolet light will increase the lysis of that H2O2 and apply that extra oxygen to the teeth, providing the whitening. So there's lots of different kits you can buy. See your dentist and talk to them first before you mess with any of that stuff, though. All right. Any other questions or comments about hydrogen peroxide?
No, I think we're good.
All right, go kiss my ass. Here we go. Let's do old people's feet. What is this one?
Boy, well, I've got a preponderance or predilection pertaining to podiatry today.
Okay.
Perplexing?
Yes.
Yeah. Anyway, I've got some neighbors. They're older gentlemen, apparently with diabetes, and they've got sort of perpetual pustules or sores of some sort on their legs, feet, and whatnot.
Yeah.
They can't seem to fucking heal them up. What is up with that? If there's anything we can do to help them, I like helping these old guys.
You want to
around,
help them?
They're nice.
No, it'd pay for their podiatry appointment. Why do old people have gnarly feet? Why do we have gnarly anything else? I mean, we're old.
Yeah.
And the one reason the feet go bad is because we're on them all the time. All of our weight is on these, we're bipedal. And it's just unbelievable the amount of force that is applied to feet. It's amazing to me that we're able to walk as long as we can. Mm-hmm. And if you see somebody that's 80 that's not walking around with a cane or a walker, that's a real feat. What were you going to say, Taze?
Oh, I was just going to say, it doesn't matter now, but
yes, it does.
No, it doesn't.
It was 10 seconds
I have
late.
all these barnacles on
Yes.
my skin now that just have popped up here recently, and my dermatologist said, "Oh, it's birthdays. That's why."
Oh, birthdays. Oh,
Yeah.
They said that to you?
They said it's those birthdays, and that's what happens.
Oh my God. Oh my God. What bedside manner that is.
Well, it's true though. You don't have little barnacles or skin. I don't know what you call them.
Ditzels.
Ditzels. You don't have ditzels
Well, you don't
when
have
you're
barnacles.
20.
You don't have barnacles.
Liver
in your
I don't
spots.
want to make it sound like I'm disgusting because
Yeah.
I don't have things like that look like barnacles on me, but that's just what I call them.
Yeah. Liver spots.
Liver spots.
You ain't take them Doan's liver
They
pills.
said, "Well, it's just them birthdays,"
Birthdays.
Yep. Oh, wow.
and it's true.
Yep. Sorry, I had the cameras off for a minute. God Lord, this is some show. We don't do the video because we want to be a video show. We like hanging out with our friends like Darren Parker and Chris Damon and David Corchado and Patty Blue and Richard Kish and those folks.
Hey,
Sean Pedrick.
Yeah, Kish was just saying the Chris has a clinical mouthwash that has hydrogen peroxide in it. I guess is help. Yeah, which is good.
Yes, they do. And so, yeah, there's. I didn't want to. I hope I didn't imply that there's no use for hydrogen peroxide.
No.
I think that people that get it and just start swigging and gargling the whole bottle, though, I just don't think that's good for you.
I don't think so.
And anyway, all right. Yeah, so Old People's Feet. If you want to help those people, buy them some slippers.
And massage their feet with coconut oil.
Yes. Get them some liniment and some salve and apply that to their feet for them. Otherwise, just drive them to their podiatry appointments. All right. There we go.
Hey, Dr. Steve.
Hey.
I got a very stupid question for you.
No such
in
thing.
regards to genetics. Hypothetically speaking, if two individuals, two of the same people, could reproduce infinitely, what are the odds, if any, that those two people would have two identical children? I don't know why I thought of it. Just did. Random thought. Want your input. Thanks.
Yeah, that's a harder problem than the one I'm going to answer. So when I was in medical school, one of the things my professor asked me a question. I said, well, I don't know the answer to that, but I do know this other related thing that was also an picky-ass little shitty point that didn't have anything to do with anything. And he said, very good. Always answer the question you know the answer to, if you can. So I appreciate that. So what I think is even more interesting is if all the people of the world reproduced, how many would have to, what are the odds that we would produce the same person twice? Okay? Mm-hmm. Not just two people, but if everybody did. And the total possible combination of alleles, okay, those are the little places in your genes that code for attributes. Mm-hmm. The total combination of alleles is approximately 70,368,744,000,000. So that's
a lot.
Trillions of times more combinations than the number of people that have ever lived. And that's why you can walk down the street and everyone is genetically unique. It is amazing to me that with two eyes, one nose, one mouth, a chin, some ears, some hair, that you can walk down the street and not be confused like, oh, yeah, that's me. It's never happened.
No. It's kind of crazy. It really is. It
is amazing to me.
Just goes to show the variations of all the genes.
Well, and it also shows how good we are at discriminating minor differences in people's faces,
that is true, too.
Because you can, if you get to know people who are genetically identical, identical twins, and at first you can't tell them apart. Then once you get to know them, it's obvious.
Yep.
Which is really interesting. They're genetically identical. They have different epigenetics, which means it's not just the genetics. There's other things going on where there are other molecules that are turning some genes on and turning some off that do cause a different internal environment.
Yep.
That's why you can have two identical twins. One's left-handed, one's right-handed, one's mathematical, one's artistic, one's gay, one's straight. It happens all the time, and I've witnessed that personally. So. But yet they're genetically identical, and you say, well, it can't be their upbringing because they were brought up in the same house, and it can't be their genetics because they're genetically identical. Then what is it? That's the only answer is epigenetics. Nano environmental changes.
Yep.
All right. Let's see here. We've only got about a minute left. Have you got something?
No.
Okay, then I'm going to play the second half of that weird guy that called last time.
I've got little inklings every now about some recent decisions you made. I applaud that wholeheartedly, and I accept whoever Dr. Steve is, because Dr. Steve is, we are all changing all the time. So, let's face it, man,
What?
They did a hell of a job, too, Doc. All right. We'll talk later on, man. Try to call me. I'm here in Pittsburgh, actually. You know the place. All right, Dr. Steve. Good to hear your voice, which I didn't, but I hope I will soon. All right. Talk to you later. Bye-bye. I'm going to hang up now. Get ready to click down and close it.
Still 3 minutes left on this call.
I'm real Luddite. I don't even know how to turn my phone off. I'm trapped here. It's going to go on. How much longer do you think your machine will be recording? Because I actually, now that I think about it, I have a few things I would like to sort of aim your way if you can bear up 77 years I just had. And I think probably I got a few things that I could maybe sort of put your way, maybe kind of give you a little better.
All right. Thanks to everyone at SiriusXM whose steadfast support of this show has sustained us over the years, particularly Lewis Johnson, Jim McClure, Sam Roberts, Jim Norton, Travis Teff, Troy Hinson, Paul Ovcharski, and Roland Campos. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Tace.
Goodbye.
Thank you, Scott.
Goodbye.
All right. All right. So let's see where we were there. Okay, I'm just going to...
camera pointed at me because that pisses me off.
What? You don't like the camera pointed at you?
No, stop it. What are you doing?
Why?
Why are you doing that?
Why?
Cause.
Okay, well, let's do another call. And then we'll do the opening, and then you can get out of here. You ready?
Yep.
Okay, here we go. Okay, well, I'll turn the camera off. At one point, I forgot I'd turned it on. It was on you for like 10 minutes.
I know.
You look fine. Stop it.
No, I'm not getting ready for this show.
Oh, I see. You didn't
I'm
doll
not
up.
getting ready for a radio show.
Yeah. Well, next time, put your cleavage shirts on, and
nobody will care what you look like then.
Yeah.
Perfect.
That's right. That's all
Men
they'll
are
be looking
dumb
at.
animals. Big dumb animals. Trust me.
All right. Let's see. Okay, let's get rid of that one. Let's get rid of that one. We have not done that. Oh, predestination. Let's do that one. All right. Oh, and this guy's got a question for you on thyroid taste. So do that. Okay, ready?
Okay.
Okay, enough of that. Why don't we take a couple more phone calls, and we'll get out of here, all right? Let's see here.
Dr. Steve, this is Terry. I hope you guys are doing well.
Hey, thanks, man.
I
You
am
too.
a regular listener, and I appreciate everything you've given me for information. And you and I have corresponded before by email. I wanted to ask, I'm beginning to get my neuropathy in my right foot has become a little bit more intense than it ever was. I have a good friend who's got it with both feet, and he's a man suffering horrendously. And I know you've talked about it before, but I would love to have you give more information about dealing with neuropathy.
Sure.
I'm in your age group, and I would love to have
42.
you talk more about it, or if you can email me, my email.
Okay. I don't want to give out. I don't want to dox the guy. So, neuropathy sucks. So there's two kinds of pain. The tree of pain has two branches: nociceptive pain and neuropathic pain. And nociceptive pain is functional pain. That's the kind of pain you get when Dr. Scott sticks a needle in you and you jump and go, "What the hell? Why are you sticking a needle in me for?"
Yep.
And you go, "Ouch." And it's the kind of pain that keeps you from sticking your hand on the hot stove twice when you're a little kid.
Right.
And then there is neuropathic pain, which just tells you that it's not functional pain. It's just telling you that there are nerves damaged. It's like, well, you can't do anything about it. Well, you can, but I mean, it's not protective really. And so the question is, what's causing the damaged nerves? Was it a toxic assault, which would be like chemotherapy or exposure to certain chemicals?
Or statins.
Yep, that is a chemical. Thank you. So is it some medication or some toxin that caused it? These are real toxins, not bullshit toxins. and then, the answer to that is, well, first stop the insult.
Yeah.
Stop, being exposed to the toxin if you can. And then number 2 would be blood sugar, which really is toxic, but we put it in a different category. So diabetic neuropathy, and they can get mononeuropathies, which are just single nerves. You can get mononeuropathy multiplex, which is single nerves all over the place, multiple single nerve problems, or you can get just peripheral neuropathy where your hands and feet start tingling and you have numbness and pain and stuff. And then you can have neuropathy from things like trauma or compression of nerves. So people have heard of carpal tunnel syndrome. That is a compression neuropathy where the nerve is being compressed as it passes from the forearm into the hand. So when you have a compressive neuropathy, the trick is to decrease the compression. That could be surgical decompression, or it could be steroids. My back, I have a compression neuropathy in my back, but it gets better when my physical medicine and rehab doc takes a foot-long needle and jams it in my back right where the pain is and injects some steroids around there, and it decreases the swelling around there. It takes the pressure off the nerve. If it's diabetes, obviously having better diabetic control helps. And now, so you remove the toxin and you get your better glucose control. Now you still have the neuropathy, though. What are you going to do about it? So we have some things that we can do. Dr. Scott, I've been monologuing. What do you guys do for people with neuropathic pain?
Well, exactly like you said. First of all, try to identify what it is, and if we can stop whatever it is they're taking, then that's stopping the insult initially.
Yep.
Yeah, but a lot of times, Dr. Steve, you can't. So we have to find out some other ways.
Yeah.
And we do a couple different therapies. One of the things we use, and we've talked about before.
Astragalus, astragalus.
Astragalus, you can always take astragalus. If you'll just visit simplyherbals.net.
Yeah, simplyherbals.net. You don't have to be coy about it. Go to simplyherbals.net. But you're not selling neuropathic supplements.
No, but hell, I'll say anything else.
Oh, Jesus.
No. I'm just kidding. But
Can
acupuncture.
Stop bullshitting?
Okay,
for certain neuropathies, we use acupuncture because it does stimulate the nerves and it helps to calm things down. I don't love using acupuncture needles in diabetic feet.
Yeah.
And I certainly don't like using them.
Give yourself a bill.
I'll give you that.
In a non-stick arm. So if someone's had, breast cancer with lymph node involvement to the side, then I don't stick needles in that side.
Okay. Good.
Just for obvious safe reasons.
Yep.
We also have a wellness machine. It's like a frequency unit, very similar to TENS unit we use sometimes to stimulate blood flow. Far infrared light works, and certainly. There
are people using infrared for neuropathy, and some of my patients have had really good results.
And some, and you know what? And we also use this stuff called white oil. It's a topical oil with some menthol and stuff in it.
Is that the white flower oil?
White flower oil, yeah. And that can help some too. And what I tell
I bought that at Amazon for myself. I like it.
It's actually pretty nice.
And then I found it at the Asian market that I go to every week.
It's good stuff. It's not very expensive, and it's pretty effective. But neuropathy is so difficult to treat, But the key is you have to figure out which one, because you can do all these things, but if it's like you and it's a radiculopathy from a stenosis.
Oh boy, you just threw out two medical jargons that people don't.
You've got a nerve pain shooting down
because of narrowing,
because of a narrowing in the spinal cord.
Thank you.
All those things we're doing really don't help as much, but a big foot-long needle stuck in your back can.
Yeah, right.
And conversely, you might have an epidural like you've had for years, and that's not what's causing. Your neuropathy,
right?
Neuralgia.
Yeah, if you had diabetic neuropathy, sticking steroids in your back would be the dumbest thing you could do.
It's going to make it worse potentially.
Right. So those are those things. Now, what can somebody do? You can go to our website, and if you go to drsteve.com, and on the right there's a menu, and one of the choices is for neuropathy sufferers. I have data that's not very good on at least 4 different supplements, nutritional supplements that you can take that at least have some data.
Yeah.
And I will say anecdotally, for me, it really helped me a lot. And so there's some information there. So there are some nutritional supplements that will supposedly helps stimulate the body to regenerate those nerves. It just gives them the building blocks so they're already there, so it'll speed the process that's already going on along. Because peripheral nerves, if you stop insulting them, they will regrow.
Yeah.
But it may take a year or two.
Yeah, you have to stop the abuse.
Now, the number one drug, if you're going to take a prescription drug, God damn it. Sorry. I got to go take some
allergy stuff.
Yeah. Well, I take money, Luke has, but I wait till this happens, then I start it back up again. Oh. The number one prescription drug for diabetic neuropathy would be duloxetine, which is also known as Cymbalta, which was originally studied as a drug for bladder spasm and then was eventually sold as an antidepressant, but it's also pretty good for that dorsal horn inhibition that will decrease the transmission of pain signals to the brain. So duloxetine, and then gabapentin was used off-label for years, and now is indicated for neuropathic pain. And then there's another one called pregabalin or Lyrica. Gabapentin is also known as Neurontin. And then the weird one, if you have chemotherapy-associated neuropathy and you got to keep taking your chemo and you've tried all those things and nothing works, you've done the supplements and you've done the duloxetine and you've done gabapentin and pregabalin, then you may be a candidate for methadone. And it sounds crazy. Methadone, well, why would you do that? That's to get you off drugs. It's like, well, they use it to get people off drugs, opioids, because it's cheap and it has a long duration of action. So it's dirt cheap. They can buy jugs of it for $40 and dose people up once a day and tell them come back tomorrow, and it'll still stay in their system for a day. It'll stave off withdrawal for 24 hours. So that's why that's used, but it's still a great drug.
Right.
And it's the only opioid that we have that is specific against the N-methyl D-aspartate receptor, or NMDA receptor. It doesn't matter what that is, but just so you know, that is a receptor that when you turn it off, and methadone does that pretty efficiently. When you turn it off, it will decrease the pain sensation that's associated with neuropathic pain. We call it hyperalgesia. Don't worry about that either. I'm just throwing the jargon out, but then I'm explaining it unlike Dr. Scott does. So, so low dose methadone can be used for cases of neuropathy when when nothing else is happening, people are desperate. So there's a multifaceted approach using some pharmacologic stuff, some non-pharmacologic stuff, and talk to your neurologist about it or your primary care, or go to our website that says and click on the link that says for neuropathy sufferers.
Yep.
Okay. All right.
Sounds good.
All right. Are we done?
I think so. I think we're good to
You
go.
don't have anything else? You got anything to plug, Dr. Scott?
Nope.
Yes, you do.
Oh, yeah, my simplyherbals.net. Get you some nasal spray.
You damn plug, you damn.
Get you some Stress Lias.
Well, thanks. Always go to Dr. Scott. Thanks, Stacey. Thanks to everyone who made this show happen over the years. It has and continues to be most fun I've had in my 6 decades of existence, 6+ decades. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Thanks goes to our listeners and the people who hang out with us during our live quote-unquote broadcast. Yeah, come hang out with us. It's usually Wednesdays, 3:30 or so Eastern time.
3:30, 4,
yeah,
4:30.
Sometimes, yeah, right. It's like I said,
5.
3:30 or so.
Neighborhood.
Usually on Wednesdays.
Sometimes Eastern Standard Time, sometimes Central, sometimes Pacific.
Yeah, that's true. It's 3:30. No, it's 3:30 Eastern times, but sometimes it's 3:30 Central or 3:30 Pacific. That is true. So it's those, but somewhere around there. Just watch our Twitter or Dr. Steve Reddit. It's reddit.com/r/drsteve, I think, or maybe drsteve202. Shit, I don't know. Let me look. Yeah, it's r/drsteve. Or our Facebook page, and I'll always post it on there before we go live. Or you can just subscribe and hit the notification button on YouTube. We're not doing this to do a video thing. People go, oh, they've only got 100 views. I don't care. We're not pushing the YouTube thing. We do that so that we can hang out with our buddies who hang out with us every week.
Right on.
And some of them are here every week, some every other week, some every once in a while. Whatever. We just have fun, and it's fun getting input from them. Yeah. And then we play music at the end. We always butcher some song, and it's terrible. Mm-hmm. But Richard Kish always says, oh, you guy, that was awesome, which is great. We know he doesn't mean it, but we appreciate it. But anyway. All right. And go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, Scott. Thanks, Tacey.
Thank you.
Bye, Holly. You should get her shout out. Okay, let's do the intro real quick.
Sure.
And we'll be done, and then we'll play a song. All right, here we go.
Where does 007 invest his savings? Bonds. Stocks and bonds. Which Jedi always got his brother's hand-me-downs? Obi-Wan Kenobi. I was going to tell you a dirty joke, but I don't want you to soil yourself.
If you just read the bio for Dr. and made popular by two really comedy shows, Opie and Anthony and Ron and Fez.
Sorry, there is nothing to repeat. One new notification. From Amazon Shopping. 2 months ago, you bought Nutricost L-Glucose. What did the vegetarian order at the steakhouse? The filet melon. What happens to candy bars when they expire? They go to the sweet hereafter. What happened to the letter that fell off the billboard? Nothing. It's just a little dirt E.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
Dr. Steve!
You take a
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott. The traditional Chinese medical practitioner gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And we have my partner in all things, Tacey, in the studio today. Hello, Tacey.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to a regular medical provider, if you can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your healthcare provider. All right. Don't forget stuff.drsteve.com, stuff.drsteve.com for all your shopping needs, your Amazon and online shopping needs. You can go there, click straight through to Amazon, or you can scroll down, look at all the cool crap we've talked about over the years. You just buy it straight off of there if you want to or not. Just go look at it. We got all kinds of goofy stuff. Check out Roadie.drsteve.com. It's ROADIE.drsteve.com. If you have someone who is a musician and you want to buy them a gift for under $200, maybe even under $150, and you want to get them something really cool that they're going to go, holy crap, this is awesome. Get them a Roadie. It is a robot automatic guitar tuner. And they have one for bass as well, or they have one for just guitar, mandolin, and other sort of lighter stringed instruments. It's the most amazing thing ever. I love it.
Pretty cool.
And you can even do it in the middle of a gig if you want to. And I think Brian May said, how come you bloody came out with this at the end of my career? So he was very impressed with it. And check out patreon.com/weirdmedicine. Patreon.com/weirdmedicine. We had Gina Levy on recently. We'll talk about that in a little bit. And we also have had Anthony Cumia from the Opie and Anthony show. Mm-hmm. As a matter of fact, we've had the Troika. We've had Anthony, Greg, and Jimmy, all three of the principals from Opie and Anthony. And one of these days we'll have to have E-Rock and Travis and some other folks from those days. I'd love to get Sam on there and talk about the first time that we met, because he was the one holding the camera the day that I first came in there and did I was going to say pap smear. I did a rectal exam on Pat Duffy the first time we were ever in studio. And Sam was holding the camera. I said, dude, just please don't get my face on here. I was terrified the AMA was going to come after me. So good old Sam. So we've known him for a long time. And then check out, I love doing Cameo. I'll say fluid to your mama and go to cameo.com/weirdmedicine. It's dirt cheap. And I'll just say, I'll say whatever you want me to within reason. And also I'm showing the waiting room, our newest bit of merchandise, which is a 16-ounce, really cool-looking vacuum drink bottle. I tried this. Today I filled it up with iced tea in the morning, and I let it sit in the hot sun in my car all day long. And when I got in to drive back home, it's an hour drive, it was still ice cold. So these things are really good. They're made by Bob Seidel at Party Shots. It's PARTSHOTS.com. And he does these weird things where they go to a golf tournament and they do all this personalized stuff on the fly at the golf tournament. So if you're doing a golf tournament like for charity or something, you can consult them and they'll come and they'll make personalized cups of people's shots and stuff like that. They do all kinds of crazy stuff. But he's a listener, and I appreciate it.
That's cool.
And he made these things for us. So we're going to be putting those on our website pretty soon. They're not insanely expensive, but they're not as inexpensive as I'd like to get them. But if you want us to autograph them, well, why would you? But we will. I don't know why you would want that. Just ruin it. You can't drink out of it once we do that. But all right. You got anything?
Nope. I think we're good.
So we talk about Simply Herbals in the next segment. So you're good.
It's all good.
Okay. All right. Thank you, Taste.
Thank you, Taste.
Welcome. I'm taking back to
where?
guitar.
Oh, you are? Oh, okay. Okay. Oh, yeah. Perfect timing. Well, I'm
He
going to turn
dinged
this
up
back on.
He dinged up his car.
2 months.
Yeah, he's not going to have a car for 2 months.
Ugh.
That he's like, when the cop comes there, he's like, I'm an asshole. I did, and it's like, dude, don't admit liability.
No.
Don't lie.
Make it prove it. Yeah.
But she hit him.
Oh, wow.
But then I talked to the cop. I said, it's obvious she hit him. And he said, yeah, I know. But he said he wasn't paying attention. So it's kind of, so I'm going to make sure her insurance company pays for hers, and ours pays for ours, because I'm not paying for hers.
Yeah. No.
You know?
Rats.
And he had the right of way.
And she hit him. Yeah, I saw our favorite attorney, Myrtle, Friday night. He had a picture of it.
Of?
The accident.
Of Beck's accident?
Yeah, you sent him one.
Who?
Myrtle.
Oh, Ermeline. David?
Yeah.
You can say his first name. Nobody's going to know what that is. Where'd you see him?
Cubby's 80th birthday party.
Okay. That sounds like a horrible, horrible time.
Dude, it was actually really nice.
Nah.
It really was. It was.
Whose birthday?
Cubby.
I don't even know who that is. I don't want to know Cubby.
He's our counsel.
Okay. Well, sounds horrible. All right. Let's see. What's the date today? Is
8/17.
8/17. Okay. And I'm just saving these in Dropbox now, so I'm not using up all of my stuff. Okay, you ready? What song we gonna do?
You play one?
Yeah. Yeah, I wonder if anybody noticed the groovy soundtrack at the beginning.
Yes, somebody did. I want to say maybe DP. So it reminds him of Smoke.
See if I can get the camera on it.
On the Moog?
That's not Moog. That's what's cool. These are Roland units, and they're little tiny. Oh, you can't see it because of the mic. Okay, here we go. Still working out the bugs on it, but I'll have a different interlude music every week. I just got it set up last night, and I'm still, obviously there's something wrong with the plugs or something, and I keep buying 3.5-inch stereo plugs, and they still don't fit that thing right.
That's weird.
Yeah, it is weird. Okay, I'm gonna okay, let's hear you.
I just sent you an email with the tab.
Oh, you did?
Yep.
Just now?
Yep, with chords.
Okay. All right.
You found it?
Yep. That's a G suspended chord, though.
You can play it, yeah.
No, you can. You have. All right. What are we doing?
We were standing on a mountaintop where the cactus flowers grow. I was wishing that the world would stop when you said we'd better go.
Whoop. Okay. Yeah,
So
okay.
go roll- yeah, I need more bass. A little more bass.
You want more bass?
Yeah, it's
No,
like-
no, it's too loud.
There you go. Think it. Yeah.
Do you want me to do it like that? Like
Yeah.
that kind of rhythm? Or
Yeah.
do you want...
No, what you're doing is fine. I just can't hear it at all.
Okay.
Yeah.
All right. I've never heard this song, so...
It's a just normal 4/4.
Okay.
We were standing on the mountaintop where the cactus flowers grow. I was wishing that the world would stop when you said we better go. Took a rowboat across the Rio Grande. Captain Pablo was our guide. For $2 and a weathered hand, he rowed us to the other side. We were dreaming like we were not inside, and we dreamed all afternoon. We asked the world away, we could celebrate the Gringo honeymoon. We stepped out onto the golden sand. The sun was high and burning down. We saddled up and we rode to town. The Ironwood tree. Sorry, guys. Tied our donkeys to an ironwood tree by the street where children play. We walked into the first place we could find, serving cold beer in the shade. We were drinking live, we was not inside, and we drink all afternoon. Asked the world away, we could celebrate Gringo honeymoon. cowboy who said that he was running from the DEA. He left his home, my wife, and a family when he made his getaway. We followed him down a street of dust, was one room run down shack. He blew a smoke ring and he smiled at us. I ain't never going back. We were flying by, it was not in sight, and we sold all afternoon. We asked the world away, we could celebrate a gringo honeymoon.
God, how long is this song? It goes on forever.
This is it. He said there's one last place that we should go. He took us to the Tempest Bar. He knew a crusty caballero who played an old gut string guitar. And he sang like Marty Robbins could, and played like no one I've ever known. For a while we knew that life was grand, and it was ours to take back home. We were singing loud, it was not inside, and we sang all afternoon. And asked the world away, we could celebrate the gringo honeymoon. We were standing
Got
on
more?
a mountaintop, this is it, where the cactus flowers grow. I was wishing that the world would stop, but Dr. Steve said, we better go. David, you are correct. That bass is great.
Shit.
It's much, much better, much, much better. Yeah, I'm working on the banjo, guys. I just started playing last week.
Yeah, that song's fun to play, but it's just
No, it's very monotone. Very monotone.
Just over and over and over again. It's like, shut up!
No, let's play something fun. Let's play something fun.
It's not your fault. It's just how.
It
maybe
is.
maybe if I could sing and play at the same time, I could do a harmony with it.
Oh, you could sing and play.
No, I cannot.
Let's do a fun one. You want to do
Yeah.
You can go back to what was it? We did the Rolling Stones.
Well, yeah, but we did that last week.
Yeah, we did that last week. Let's do
we can do Wild Horses anytime you want to do Wild Horses. I'm never gonna say no
let's
to that.
do
Let's do a different Rolling Stones song.
Well, that'd be cool.
Or we should pick out. Oh, what about? Do you remember that song, "The Israelites"? It was a. Let me see if I can find it. Hang on.
Israel. I don't think so.
It was when we were kids. Let's see. And it was actually a reggae song.
Oh,
but
no.
nobody knew that.
Yeah,
they didn't know what
yeah.
reggae was.
Huh. Wonder what it was.
Hang on. And I don't know how certain reggae songs made it to American pop music, and other ones didn't. Yeah, it was Desmond Decker and D in there.
Yeah, yeah.
So we could do it, but do it slow, and then I could do the bass thing. So we should work on that for next time.
Okay.
Would that be okay? You want to try it?
Sure.
It'll be a good song for us to do.
Okay.
And with the banjo and the bass and your twang, and doing Desmond Decker and the Aces Israelite song, I think it'd be fun.
Sounds good. Let's do.
And what about what did what about
Dead Flowers?
No, the Bob Marley song.
Oh, Stir It Up?
No. Salvation Song, something song.
Salvation
No, that's not it. Something song.
The songs of
So what is it?
Redemption
Song. Thank you. What about Redemption Song? You want to try that?
Yeah, let me look. Let me see. Kush is kind of like me. He's like, no, Dr. Steve, don't show how old you are by that song.
What, the Israelites?
Yes.
No, but that's the whole
hilarious.
point, is
It
nobody would know
hilarious.
that song.
Hang on, Redemption song, Bob Marley. Let's see what we're looking like here. I don't think we've ever. It's in G. Old pirates, yes they rob I.
Yeah. Let me see.
To the merchant ships. Minutes after I bottomless pit. Oh God! I
You
don't
have to know it though.
I know the song. I don't know if I can play it.
Yes, you can. Is it hard?
No. It's not hard. Also, I need some rhythm. I have no rhythm. That's why I have
Yeah.
you. All right, we got Redemption, Sean. Yeah, Sean, that's what we're looking at right now. Old pirates, yes, they rob I. Sold to the merchant ships. Minutes after.
Okay, we're gonna have to. You and I. Can you come over Saturday? This would be a good one for us to play
Yeah,
if
I
we
think
can
so.
pull it off.
The bottomless pit.
And then we got to play it with him a couple of times, and then you'll get it.
Yeah.
But
Yeah, Sean, we can.
But my hand was made me strong by the hand of the Almighty. We forward in this generation triumphantly. Anyway.
This should be 8, huh?
Yeah. Won't you help to sing these songs of freedom? Anyway, okay?
Yep.
So we'll learn that one. What is another one?
Let's see.
Because I think with the banjo or the mandolin doing reggae songs, because people love those songs, but it's weird hearing you with your country stuff and just a banjo.
I don't think
bass.
we did.
And doing the reggae songs is kind of fun.
Yeah, we didn't play let's see, Bob Marley. We have played.
What was the other
Stir It Up. We played Stir It Up on
Yeah.
mandolin. We could do it in banjo, see what it sounds like on banjo.
Yeah. Well, let's do something where we're going to lose everybody.
Yeah, let's do it. Let's do Stir It Up. You want to do it?
Yeah, I got to remind myself the bass line. Hang on. Now listen to it. Chicka. Chick. Okay. Boom, doo, doo, doo. Wait, hang on. You're doing it, G.
Oh, yeah.
Oh, I got it.
Yep, you got it. Steer it up, little darling, steer it up. steer it up. Little darling, steer it up. It's been a long time, yeah, since I got you on my mind. Now you are here, and I said it so clear. To see what we could do, baby. Just me and you. Come on and steer it up. Little darling, steer it up. Come on and steer it up.
Wait a minute.
There you go.
Well, that's okay. Okay, got it.
Steer it up, little darling, steer it up. Little darling, steer it up. Little darling, steer it up. I'll push the wood, sir. Then I'll blaze your fire. Then I'll satisfy your heart's desire. Steer it up, little darling, steer it up. Little baby, steer it up. Little darling, steer it up. Oh baby, quench me when I'm thirsty. Come on and cool me down, baby. When I'm hot, your recipe is, darling, so tasty. When you show you stir your pot. Come on and steer it up. Little darling, steer it up. Little darling, steer it up.
Damn it.
Stir it up. Little darling, steer it up. Come on, baby, now steer it up. There you go.
Yeah, terrible.
That's awful. Terrible. That's terrible.
I would say it's really hard to sing and do the syncopated.
Yeah, I lost that rhythm about 4 seconds
about
in.
4 seconds in. That's about right. All right. Anyway.
All right.
Well, see, Redemption Song, you don't have to do that because that's a straight ballad.
Yeah.
You know?
What's it sound like?
Redemption Song?
Yeah, Redemption.
Oh, you don't know it. Yeah. Okay,
Yeah.
hang on.
I mean, I know I've heard it.
Hang on. I'll get it for you.
Let's hear it. Hey, Kush, we sound better with headphones and after you've had some intoxicants.
Some Kush.
Yeah, some Kush. That's much more just.
From the bottomless pit, but my aim was made strong.
What key's he in?
By the hand of the Almighty.
That's A minor.
Okay.
G.
In this generation, triumphantly, won't you help the sing?
G.
These songs of freedom is all I ever had.
E. C.
Redemption.
G. C. D. G. C. D. G. E minor. C. A. E minor. C. D. G. E minor. C. G. A minor. G. E minor. C. A. D. G. C. D. G. C. D. E minor. D. G. C. C. G. Sorry.
It's all right.
C. D. C. Okay, that's how it goes. It's a real pretty song if we do it right. All right, we'll get a copyright strike, but that's okay. That just means you can't monetize your channel, which we're not trying to do anyway. So who cares?
It's all good.
All right.
Yep.
So we'll do that. You gonna come over this weekend?
Emancipate yourselves.
Okay, you're gonna try it. Okay.
No,
he's
no,
gonna
no,
try
no,
it.
no.
That's fine.
No, just wanted to.
Yeah.
But that's so that's in G.
Yep. Emancipate yourselves from mental slavery.
Yep. None but ourselves can free our minds. Okay.
Have no fear for atomic energy.
'Cause none of them can stop the time. How long shall they kill our prophets while we stand and look around? Some say it's a part of it. We've got to fulfill the book. Won't you help me sing redemption song?
No. No, it's close. But
No, I'm sorry, yeah.
won't you help to sing?
Oh, yeah, won't you help to sing
These songs.
songs of freedom? Yeah, I was reading wrong one.
It's all I ever
All
had.
I ever had. Redemption song. Redemption songs. Redemption song. Oh, an instrumental, cool.
No, that's enough. Anyway, so we'll
All right.
work on that.
Yeah. All right, guys.
Thank you, everybody.
Thank you, Kim. Thank you, Kush. Shannon. Who else? Chado. Hope you guys have a good week.
Oh, it was moderating people saying the F word. So we need to, if you see that where it says show or hide, you can just click show and then it allows their comment.
Okay, yeah. Good stuff. Oh my gosh.
All right, we'll work on
so
that.
much fun, so much fun.
All right. Thanks, everybody.
Thank you.
Appreciate you hanging
Go
out with us. We
Sayans.
really do.
Sayans.
It makes it way, way, way more fun.
Way more fun.
Yeah.
Even though we're awful, it's more fun.
Yeah. But we know we're awful. That's the difference. These connectors are shit. Okay, just realized I was still at the channel up. Sorry, everybody. Trying to work out the kinks with this thing. It's the cables, I think, but it also means that they're plugs, that they're jacks, if they're that kinky. But anyway, all right, hey, sorry about that.